Welcome to this episode of the IVEC Expert Perspectives. Today's appointment is really very special and diverse, and this is because we have a very special guest, Dr. Andrae Koroll. Dr. Andrae Koroll is speaking with us from Odessa, the pearl of the Black Sea. Unfortunately, a city strenuously defended by the Ukrainian military forces from repeated Russian attacks and attempts of invasion. Dr. Andrae Koroll is a retina specialist. He is the head of the laser department of one of the largest tertiary referral centers for eye care and ocular traumatology, the Fілатова Institute of Eye Diseases and Tissue Therapy. And again, Andrae, despite the many impediments, the extra work and everyday threats of an ongoing war, you have managed to remain an active member of the international retina community. You've been attending congresses by giving presentation, and you're still involved in research, and you're the author of several important papers. Again, thank you very much, Andrae. And we are going to learn from your direct voice how your hospital in Odessa is organizing and managing care to patients in these war times. And you're treating, I imagine, routine patients, and you're also treating a large number of wounded civilians or soldiers. And you're doing an amazing work there. So again, thank you for spending your time with us. So we are hearing terrible news from Odessa in recent days. Can you just start by telling us what's the current situation there?
Yeah. First of all, of course, I want to thank you, dear Paolo, that I'm invited here to take some speech for interview experts. And in Odessa, in Ukraine, especially in Odessa, 3 nights in a row, we have raid alarms all nights. And last alarm was finished just maybe 10 minutes before this interview. So, of course, this is big problem also for everybody, for civilians, and especially for doctors, because at night doctors, ophthalmologists must sleep, and on the morning they go to clinic and treat patients. But of course, our institution has big experience because it was established in 1936. So we have a great history, a long history, more than 85 years. And our institution, as a medical institution, took part in Second World War, and after the Second World War, it cared about wounded soldiers, wounded civilians. So this past experience is very useful in recent war. And I need to emphasize that war in Ukraine not from 22nd, but from 2014, so more than 9 years. And our institution take cares about wounded soldiers and wounded civilians more than 9 years in this war, in this aggression from Russia side.
This means that your institute is basically receiving all the wounded soldiers from different parts of Ukrainian area, including probably Crimea and different parts. And this has been going on for years now.
I will specify that military system has own system of care, medical care for wounded soldiers. and they have several hospitals, but they send to our institution the most difficult and most severe cases. A lot of times they send to us soldiers with only one eye, last eye, for enucleation. They don't want to perform enucleation. They send this soldier to our institution, but our specialists, our traumatologists, perform everything possible and impossible to save even light perception for these wounded soldiers or civilians. So a lot of times we may save these last eyes, and we have hope for these people for a future life.
Okay, this is great, Andriy, and everybody I think is grateful for what you do on a daily basis, despite the current situation, which is not really letting you work quietly during the day and even during the night. Can you tell us, you were already telling us, but what type of ocular injuries do you see these days, and how many patients are referred to your hospital on average for being wounded during the attacks?
Of course, in this war, mine blast injuries is the main type of injury, because a lot of minefields, a lot of missiles, all of types, a lot of artillery. So this is very severe injuries with poly-organ injury, not only eye, but also head and body and arms, legs, so on. And this is problem for ophthalmologists, because of course the first aim is to save the life of this wounded soldier. And they in military hospitals they take care about their life. And after 2 weeks, 3 weeks, maybe 1 month and more, when they already saved the life, they send to ophthalmologists to repair, for reconstruction, or for foreign body extraction, or some for orbital plastic, for extraction of orbital foreign bodies, so on. So ophthalmic problems is the last problem, is this in a row, this problem.
I see. So I imagine your activity in your retina division has greatly changed during the last couple of years. Can you tell us both what routine activities you were doing before the war came in, and how did you reorganize your activity after the war was part of your daily activity?
Actually, we have several departments which deal with retina. So we have separate traumatic department, separate vitreoretinal department, a separate laser department. I'm head of laser department, and we have separate department for medical retina, for uveitis and for blood circulation problems. So, as I mentioned earlier, our traumatic department take cares about traumatic problems more than 9 years about this war. So only one change for this department, several times more patients. So we have about 50 wounded soldiers in time. All our inpatient part contains about 470 beds. So we are the huge ophthalmic institution. We have 9 clinics for cataract glaucoma surgery, pediatric, ophthalmology, cornea transplantation, eye burns, traumatic, laser department, so on. So we have even separate eye burns department. We have our ophthalmology department take cares about injury of orbit. So if foreign body situated in orbit, this wounded soldier goes to our ophthalmology department. If foreign body in the eye, this patient goes to traumatic department. But our vitreoretinal surgery department take cares about every type of retinal detachment, diabetic patients, Hippel-Lindau patients, and so on. Also, we perform vitreoretinal surgery even for melanoma of choroid, for big melanomas.
So you're both taking care of the wounded patients, both civilians and military personnel, and the let's call it the normal cases, cataract surgery or whatever is doing routinely. So
yes, of course.
You have a great pressure on yourself and the hospital as well.
Yes, of course. We have not only wounded persons. We have also soldiers. For example, in my department, we have a lot of soldiers with chronic serous chorioretinopathy. So this amount of these patients increased in several times.
I see.
Our medical retina department with uveitis, they achieved a lot of post-contusion optic nerve atrophy. Also, they have several types of uveitis after the Lyme disease, borreliosis. So,
yes.
Of course, because soldiers situated in the forests, and they have ticks, and after that they have problems with Lyme disease.
Yes, I imagine you might have also some issues with the supplies for the hospital. I mean, medical supplies or any type of supply. How you manage that?
This is a big problem, really, because we have enough of equipment, lasers, vitreoretinal machines, cataract machines. We have great specialists, the best of the best in Ukraine, and but we have big problem even with anesthesia drops, even with mydriatic drops, and huge problem with corneal transplants, because these mind blast injuries, they perform multiple foreign bodies in corneas with eye burns, and we need to replace these corneas, and this is a huge problem in Ukraine. Also, another part, in cases when we need to enucleate eye, we have big lack of orbital implants. But of course, we have humanitarian aid, very big aid from European Society of Cataract and Refractive Surgeons, big help from Israel Ophthalmic Society, from USA, from Poland, from Moldova. They are our neighbors, and my colleagues send us anesthesia drops, mydriatic drops, so on. But of course, we need these all types of additional supplies, vitreoretinal supplies. It was some time, maybe about 1 year ago, when we calculated all supplies for vitreoretinal surgery in Ukraine. We knew exact amount of vitreoretinal sets for surgery. It was a big problem, but now it's some better.
Is there any message you would like to give to Ukraine?
Message is very difficult. Of course, I think another ophthalmologist in other world need to know that Ukraine has great people, and Ukraine is the country of the great people that may resist any aggression, but they need help from world community, and we are of course grateful for all help which was came from Europe and from other countries for Ukrainian people, for civilians, for soldiers, for ophthalmologists, and for other medical professionals, because without this help it will be very difficult to resist the Russia as terrorist state.
Andriy, of course, our solidarity to you and all of you there, and I hope you can do your job in a very fruitful mission as you're doing. And all of us are praying for the peace to come soon, so that you can go back to normality. We know that it will take time, even though the peace is coming hopefully soon. You will have to face a lot of patients and then wounded patients, but we hope peace is coming soon. Thank you very much, Andriy, and I hope to see as soon as possible in one of the meetings around the world.
Yeah, thank you very much. I plan to go to Euretina in Amsterdam, and I hope to see you again.
Fantastic.
There.
And let us know if we can do anything for you and the hospital.
Yeah, thank you very much.